Welcome to Medical Halo's weekly roundup of the most important developments in global pharmaceuticals. This week, we cover landmark generic approvals expanding access to life-saving medications, breakthrough regulatory decisions for novel therapies, and promising clinical trial results that could transform treatment for challenging diseases. Generic drug breakthroughs expand patient access. The U.S. Food and Drug Administration (FDA) approved multiple generic versions of AstraZeneca's blockbuster diabetes and heart failure drug Farxiga dapagliflozin this past week, a major milestone for patient access. First generics launched April 8, with additional clearance for Alembic Pharmaceuticals and Lupin Limited by April 14. Dapagliflozin, an SGLT2 inhibitor, improves glycemic control in adults with type 2 diabetes and reduces heart failure hospitalization risk in those with cardiovascular disease or risk factors. Generics carry identical contraindications, warnings and precautions as the brand name product, including alerts for diabetic ketoacidosis and volume depletion. In other generic news, Ani Pharmaceuticals launched its generic carbitrol carbamazepine extended release capsules April 13, available in 100 mg, 200 mg and 300 mg strengths. This anticonvulsant treats epilepsy and neurological disorders with less frequent dosing than immediate release formulations. U.S. annual sales for this product reached approximately $65 million in the 12 months ending February 2026 IQVIA data, promising clinical trial results. Actuate Therapeutics announced April 14 that Phase 3 results for elraglusib plus chemotherapy in previously untreated metastatic pancreatic ductal adenocarcinoma were published in Nature Medicine. Adding elraglusib to gemcitabine and nab-paclitaxel GNP significantly improved overall survival versus GNP alone. Median overall survival was 10.1 months in the elraglusib or GNP arm versus 7.2 months in controls HR0. 62, p equals 0.001, representing a 38% reduction in death risk. 1-year survival was 44 versus 22%, and 18-month survival exceeded 20 versus just 4 in controls. Consistent benefits were seen across all subgroups, including patients with liver metastases and high disease burden. In infectious disease, Acuris announced April 16 that the FDA granted priority review to its NDA for pritelivir, a novel antiviral for acyclovir-resistant mucocutaneous HSV infections in immunocompromised patients. The DUFA target date is Q4 2026. If approved, pritelivir would be the first new HSV treatment in over 2 decades. Acuris also presented new Phase 3 data at ESCMID 2026 in Munich, showing improved response rates with extended treatment up to 42 days. Among continuing patients, 82, 4 on pritelivir achieved complete lesion healing versus 42, 0 on investigators' choice therapy. For more comprehensive coverage of the latest pharmaceutical news, regulatory updates and clinical trial results, please visit www.medicalhalo.com.